Hey there, it's Paul. I was thinking back to last week's sessions, in particular, two sessions where I made two different men cry. Now, I didn't make them cry, but I brought up issues that were clearly too close to home. A beginning therapist might say to themselves, "Oh no, what do I do? This is bad. This is uncomfortable." But to a seasoned therapist, we're saying, "Oh yes, this is a good milestone. Let's run with it." You see, if people can have insight and awareness of how past trauma affect their day-to-day, they're not going to see someone like me. And these new clients, they're not coming to me saying, "Okay, Paul, I have past trauma that I need to work on so that I can make better decisions in my day-to-day." A lot of these issues are a mystery to them, and it's, at least in the beginning, a mystery to me. So I kind of look at a client's issues almost like a house. And I'm coming in with my tools. I'm the home repairman. I'm waiting to get in so that I can work on the problem. But the doors are locked. The windows are locked. I'm peering through. I see, oh, well, maybe that has to do with the issue, or how about, probably not that. But I'm literally on the outside looking in. And until I can get in, I can't help. So tears is an opening, literally. It allows me into the house where I can start to work on issues with my client. But tears, they're tough, in particular for men, for three reasons. One, they're connecting to very painful memories, and it's upsetting. Two, tears represent a lack of control, and that is unacceptable for most men. And three, you're embarrassed by crying in front of your therapist. It's very unnerving, and it shows that we're weak. So when I see new men clients start to tear up, I recognize they're experiencing those three sets of emotions. So sometimes, even though it's comfortable for me that they're crying, I'll break up the tension with a joke. A lot of times I'll say something like, "Gee, thanks a lot, Paul. You're supposed to make me feel better. And clearly I'm feeling worse. You're a terrible therapist. You suck." And usually by that time, the client, breaks a smile and the tension is broken. I agree technically that as a therapist, part of my job is to make my clients feel better. But what if feeling better means avoiding painful issues? And that's probably what my clients have been doing historically long before they started therapy. I see good therapy as almost like going to the dentist. And why do we avoid going? Because of pain. We know we have a little something going on. It starts as a twinge, then it starts to hurt, and we're like, "Oh man, I got a cavity." But I'm afraid of going to the dentist. So what do? I avoid. I start eating on the other side of my mouth. I avoid cold drinks. Maybe I put some kind of ointment on that tooth to anesthetize the pain. And guess what? We know it's growing, it's hurting, it's getting bigger. And it gets to a point where you're so miserable, you're like, "Fine, I'm going to go." And so we go. And people who are struggling with serious issues, I think they're doing the same thing. They're avoiding the pain. They recognize they have a wound, but they're afraid of going to the therapist. And so what do? They avoid thinking about it. They throw themselves in their work. They anesthetize their pain and hurt through alcohol and drugs. They blame other people for all their issues. So I see going to the dentist or going to a therapist is sort of the same thing. You have to enter into a little pain in order to resolve the wound correctly. Using the dentist analogy, you have to endure a little bit of pain, usually the needle, some drilling, in order to fix the wound, the cavity, correctly. Well, when you go to therapy, you have to enter into a little pain, and that is talking about the real issues that are hard to talk about, that are painful, with the goal of catharsis and closure, getting feelings out and establishing closure with them. And learning some tools to manage your feelings, maybe learning how to set boundaries and limits with people that are negative, things like that. And yes, good therapy also involves tears, and that's okay. Sometimes I hear people talk about their therapy sessions, and I hear a lot of light-hearted banter, laughter, talking about current events. And a little part of me is like, are you really talking about serious issues or not? Because you see, a good therapist has to be comfortable making their clients uncomfortable, talking about real issues, not just the weather or how your week was. If a therapist is uncomfortable talking about sensitive issues their client is going through, you have to wonder if those issues are too close to home for the therapist. Many of us end up going to get our bachelor's in psych mainly to figure out what's wrong with us. And, we may get a diagnosis or a clinical sense of what's going on with us. Of course, it's not enough. And then some of us go on to get our master's. But in the master's program, you're required to get 6 to 12 months of your own therapy. Because, you can't clean someone else's house if your house is dirty. But if you don't resolve your own issues, how are you going to be of help to your clients? Can you imagine, say I have unresolved dad issues, and sure enough, I end up with a client with unresolved dad issues. I might say, well, screw your dad. He's a bad man. Dads are bad. You need to avoid him. He's awful. And the client's like, okay. Clearly that's inappropriate. But that's what happens when you don't resolve your own issues and then you try to help others who have the same issue. I call those folks wounded healers. So if you find yourself always in sessions with lighthearted banter, laughter, lots of talk about sports, local events, with the inevitable, so how was your week? Well, maybe you should look for that dentist-like therapist, the one that makes you enter into a little bit of pain in order to resolve your real issues, like me. Not that I'm advertising. By the way, those 2 clients that teared up, we explored what was going on at that moment, that opening I talked about earlier, and we made some progress. And it was kind of neat. We have these every now and then as therapists where that client has that aha moment, that insight and understanding connects in. And it's when we see that happen, it's like Christmas. So at the end of the week, I'm driving home and I'm thinking about those 2 clients. And I was thinking to myself, I'm 63, I've been doing this for 34 years, and I still got it. And it felt really good. When you're a therapist and you're able to help clients through their darkest times, to deal with pain, hurt, abuse, abandonment, neglect, and help them have a better life, it is just so rewarding. It's the best feeling ever. What's that cliche where if you love what you do, then it doesn't seem like work? Well, last week it didn't feel like work. So I thought I'd share these moments with you. And really that's the goal of this channel, Paul's Simple Psych, where I take quips, stories, lessons learned in therapy sessions, and I share them with you in the hopes that it helps you in your journey moving forward. So if you like this video, if you like this content, and you'd like to see more, please give the channel some love. My name is Paul, and I'll see you on the next one. Take care. Peace.